Motility disorders of the esophagus have a number of key characteristics that you need to know about. They will all present with difficulty swallowing or dysphagia, and they may be associated with heartburn as well, but these are rather non-specific symptoms and won't really give you an idea as to whether or not it's actually a motility disorder. They may also present with regurgitation, which is also characteristic of upper esophageal and oropharyngeal disorders. So again, it's not really a very specific symptom of motility disorders of the esophagus. Patients will, however, complain of chest pain, and this will lead to some confusion as you may be drawn to think about cardiac causes of chest pain in someone also complaining of dysphagia. So often in the workup of these patients, you'll need to do cardiac markers and ECG and perhaps even a stress test to reassure yourself that the patient doesn't have a cardiac cause of their chest pain before investigating the dysphagia further. Really, in summary, when you look at these motility disorders, the key characteristics are that dysphagia, difficulty swallowing, heartburn, chest pain and regurgitation in someone who has a negative cardiac workup, and even in someone who has a normal endoscope of their esophagus. So when you do endoscopy of the esophagus, in these motility disorders, you're not going to see any abnormality either. The key test really in diagnosing these motility disorders is manometry, which measures the amplitude, the pressures and the duration of peristalsis in the esophagus. So let's talk about that a bit further, particularly in regard to how we differentiate between these different disorders. Diffuse esophageal spasm is the first of these motility disorders we're going to talk about. It is characterized by diffuse spasm of the esophagus, whereby you see on manometry a number of key features. More than 20% of the esophagus will be undergoing peristalsis of multiple contractions of the esophagus with large amplitude waves of more than 6-second duration. So what you're seeing are these big peristaltic